Hello, Kelechi speaking on issues of health because health is wealth. There has been a recent outbreak of Lassa fever in Nigeria. According to Lassa's situation report from the Nigerian Center for Disease Control (NCDC) as at 19 January 2020, a total of 163 confirmed cases and 24 deaths has been recorded across 8 states of Nigeria. The affected states include Ondo, Edo, Ebonyi, Taraba, Plateau, Bauchi, Ogun, and Abia State. This is serious. Where are we going from here? Lassa fever is an acute viral hemorrhagic fever, VHF, caused by the Lassa virus. The natural reservoir for the virus is the Masterman's natalensis rodent, commonly known as the multi-marmot rat. Other rodents have also been identified who carry the virus. Lassa fever remains a major public health challenge in West Africa, with Nigeria bearing the highest burden. It occurs throughout the year, but more cases are recorded during the dry season, that is November through May. Now, it is very important for us to realize that on 19th of March 2018, World Health Organization declared that the statistics of having 203 suspected cases in January alone in Nigeria marks the worst Lassa fever outbreak ever recorded. And if you look at what happened in that year, you realize that as at March, we were having over 1,000 confirmed cases of Lassa fever. This is a sign that things are getting worse. If you check the records. In 2016, we only had 109 cases. In 2017, we had 143 cases. So where are we heading to? Now we are still in January and we are experiencing over 200 cases. Now, what is actually happening? Lassa fever, according to medical history, derives its origin from Lassa, a small community in Askira Oba, a southern part of Borno, in 1969, when a white woman had developed a hemorrhagic fever caused by a virus, later named Lassa fever. Symptoms include headache, vomiting, and muscle pains. The hemorrhagic fever is like that of Ebola because they belong to the same family. Some people who get infected have few or no symptoms. Others get what appears to be a mild flu or malaria, so it can easily be deceptive. Severe cases can lead to renal failure, deafness, and for pregnant women, spontaneous abortion. This is not good. Lassa is deadly, as roughly of having 20%, that is 1 out of 5 of people with Lassa end up dead. That is a deadly disease. So what do we do? As we are thinking of what to do, the virus, this fever is spreading, because 4 cases of Lassa fever have been reported in Borno State, with 1 patient already dead. Now, when we listen to the Commissioner of Health, Dr. Salihu, who disclosed at a press conference in Maiduguri on Thursday that 3 patients infected with Lassa fever were discovered after the death of the first victim, a case that was just reported last Saturday. This is not good. Now, precisely on the 18th January 2020, we received a patient at the University of Maiduguri Teaching Hospital, UMTH, who had symptoms of Lassa fever. Unfortunately, we lost the patient, the commissioner said. He said the medical team had conducted laboratory investigation after taking some samples and established the presence of Lassa fever in the patient's system. He said efforts had also been put in place to establish all those who had contact with the patient within the period, with a view to quarantining them. He said 3 more Lassa fever patients had been isolated. One of the patients had contacted the first victim in Kano and is infected now. Dr. Salihu explained. This is not good. He said the government decided to alert members of the public about the presence of Lassa fever in the state. He urged the people to maintain high level of hygiene in their homes and environments. He appealed to the people not to panic as government had put enough measures in place, including free treatment to halt the spread of the infectious disease. In case of any contact with any individual having symptoms of Lassa fever, like bleeding in the nose or ear, go to designated hospitals in Maiduguri, he said. Where are we going? We need to keep our environment very, very neat. For those of us that like eating bushmeat, rats, it's time to keep off because things need to be controlled. Already we have 24 people dead as a result of this Lassa fever, and over 150 lives is at risk. So we need to be very cautious. Now, looking at how this Lassa fever spreads, first is direct contact with urine, feces, saliva, or blood of infected rats. I want to remove that word infected because we can't tell of a rat that is infected and the one that is not. So contact with objects, household items, and surfaces or eating food contaminated with urine, feces, saliva, or blood of rat is posing danger to your life. When you find a dead rat in your house, don't pick it with bare hands. The blood and bodily fluid of the living or dead rat can infect you. Now, person-to-person transmission by contact with blood, urine, feces, vomitus, and other body fluids of an infected person can get you infected. The signs and symptoms as well as prevention are represented in the graphic illustration sourced from Nigerian Center for Disease Control, as you see here. Now, the signs and symptoms: 1. High fever, which some people mistake to be malaria or typhoid fever. Sore throat, vomiting, chest pain, back pain, general muscle pain, cough, diarrhea, stomach pain, swollen face, eyes and neck, bleeding from ears, eyes, nose, mouth, and other body openings. So anytime you feel pains all over your body, you have to think twice. Go for a test. Now, if you look at how to prevent yourself from being infected, washing of hands is very, very important. Now, prevent rats from getting into your house by any means necessary. Do not touch rats, whether dead or alive, with bare hands. I said this before. And then avoid eating fruit eaten by rats. Ensure that you seal your food in containers. Block all holes in the house. Wash hands regularly with soap under running water always. Under running water is very, very important. Store food in covered container. Do not dry food in the open place or on the floor, like many people spray their grains waiting for sun to dry it. Before you get back to it, the rats have already defecated and urinated on it, and by the time you eat this food, you expose yourself. Cook all food properly before eating. Clean your home and surroundings regularly. Avoid person-to-person contact with someone who had the disease. Now, dispose waste properly in covered dustbin. Avoid self-medication. Ensure to go straight to approved health facilities once you notice any sign. So, if you notice any of these signs and symptoms, go to a nearest health center immediately or call this toll-free line 080-097-000010. There is treatment for Lassa fever. Early reporting and treatment save lives. Thank you.